It's all in your head. You don't look sick. Your tests are normal. It's probably anxiety. There's nothing wrong with you. Have you heard these words from physicians, family, and friends? If you're someone who has been struggling and swirling through the revolving door of healthcare to find answers about your health, or if you know someone who is going through this experience, then this podcast is for you. Welcome to the Desperate for a Diagnosis podcast with Laura Nozicka, a show dedicated to exploring the challenges of living with undiagnosed or rare medical conditions. This podcast explores both sides of the bedside. We will be speaking with patients who have had challenges with finding a diagnosis, along with experts in the field. I'm your host, Laura Nozicka. Please note I am not a medical professional, nor am I affiliated with any healthcare, pharmaceutical, or device company. I am an entrepreneur, and I am an independent market researcher focused on helping healthcare organizations better understand the patient perspective. The podcast is not meant to offer medical advice, but to merely share the stories and perspectives of podcast guests. Welcome to another episode of the Desperate for a Diagnosis podcast. I am so happy to say that I am here with a friend of the show because she's been here before. She's been here on the show with a colleague, but I'm happy to welcome back Dr. Collette Edwards. Dr. Edwards, thanks for being back. Happy to see you.
For having me back.
Yeah, so it's been since December since we launched your last episode with Charlene, and we were talking about your book, which I'll mention in just a little bit, but I'm happy to have you back and to give everyone a refresher about Dr. Edwards and her amazing background. Here we go. She is a board-certified physician with additional training in health and wellness coaching at the Maryland University of Integrative Health and in health equity as a member of the NIH Scholars Program in Translational Health Disparities. That sounds very impressive and very related. And we can talk more about that because I know we like to talk about health disparities because we know that is something that's first and kind of at the forefront these days. And I know it's something you're very passionate about as well. So we will talk about that some more. But Dr. Edwards has been the Associate Medical Director of a multi-specialty group practice and has served in health plan medical director roles. And oh, how we love talking about insurance, too. Quite the evil topic that we like to talk about, the necessary evil of our lives here as it stands. Her work has also encompassed positions at 2 Fortune 50 companies, including as the National Medical Lead for Health Disparities, with an initiative that won a National Innovation Award, and as a corporate medical executive for employee health and well-being with a multi-year record of national awards. She is also the managing editor of the Wharton Healthcare Quarterly and co-author of Navigating Your Healthcare Journey, Lessons Learned to Get the Care You Need and Deserve, which is the episode that you were guesting with back in December, where you and Charlene joined and talked about your book at that point in time. But Dr. Edwards has been, I don't think she's had a vacation. She may not have one.
Would be true.
A while. I'm guessing the vacation's not in the books in the near term, but she's been really busy with other really amazing endeavors. And I'm excited to talk about it because since she was here last, she has launched Positive Health, which is a holistic, inclusive digital health destination for women who are moving through all stages of it's the M word. The M word. The M word is menopause, the menopause journey, with the programming being currently in testing or beta status at this point, but I've been to her website and have looked through all of the really amazing services that she's offering for women in this, again, crazy menopause journey. And she is the founder and chief medical officer of Positive Health. So, Dr. Edwards, you are rocking and rolling these days.
Thank you so much. Yes, I have been busy, and my last vacation was last summer. So you are indeed correct about that.
I hope it was highly memorable and you took lots of pictures and go back to those every so often when you're feeling.
Yeah, it was my niece's wedding out in Seattle, and the I've always really liked Seattle. The weather was perfect, and the wedding and the events around it were lovely. So
Oh, well,
it was great.
hopefully there's one on the books eventually here, but in the meantime, you're doing all these amazing things and helping women of a certain age go through menopause, and I just so happen to be one of them. So this is really a conversation that I am really anxious to talk with you about. Well, yes, hopefully vacations are on the books. And for some of you ladies out there who go on vacation and you're experiencing hot flashes and all kinds of other things while you're on vacation and doing other things in the course of life, Dr. Edwards, let's talk menopause. And I want to kick it off asking you how you describe menopause, certainly from a clinical standpoint, but for people out there and maybe the ladies who aren't there yet, and maybe for men who probably don't have a clue. All they know is that my wife's crabby and I'm sleeping in a second bedroom. But how would you describe it? And is it a condition? Is it a disease? Is it, how's it recognized? How do you describe it? What's your perspective on that?
So I would say it's definitely not a disease. I wouldn't even call it a condition. It is a normal, natural life transition. And if women live long enough, they will inevitably go through it. Now, it may be at different ages and different ways, but the technical definition is when you have gone 12 consecutive months without having a period.
Mm.
Now, obviously, if you have had a hysterectomy, then it happens sooner. So, and if you are on birth control, it can be sometimes difficult to know exactly when it's happening, but that's the technical definition. And you're taking those other things into account. And I think that it's also important for people to recognize that it can start in terms of symptoms much, much earlier than I think most people think. So for most women, there's the lead up to that day, which is perimenopause. And then after that day, you're into the post-menopause stage. And when people have the symptoms that people typically think of, although you can have those same symptoms in the postmenopause stage, it's typically perimenopause. And then over time, the types of symptoms you experience may evolve and change.
Yeah. Yeah, because I keep saying, when is it going to be over? I'm still waiting. For me, I think maybe it started maybe 47-ish with the hot flashes.
Yeah,
And then it rolled into the night sweats to varying degrees, and doing laundry, more and more laundry at that point because the pajamas would just be
right,
soaked in the sheets. It was terrible. It was just and then sleepless nights because of that. And
right.
yeah, and then my sleeping is just all messed up. And then things kind of slowed down a little bit, and then those hot flashes came back. I mean, it's been kind of this up and down cycle, and some things have subsided, and then some days it surprises me. So when does it end? Does it ever really end?
So, I mean, technically, the postmenopause stage is literally the rest of your life. In terms of, for many people, the period of time where you have the intensity of the symptoms is kind of maybe 4 to 5 years, but for some people it can go on for 14 years, but for some people it can be even longer. So my mother has a friend who is in her 80s, and she had been on hormone therapy, and when she stopped it, the hot flashes all came back.
Wow.
And for her, even though there potentially could be greater risks with staying on the medication, for her, it was important enough. And she just said, she couldn't live that way. Now, I don't think that that is the norm, but you could still be experiencing things way beyond the time that people think um, would be typical. And then kind of at the other end of the spectrum, people may experience the onset of menopause at a much younger age and fall into the category of premature, which would be that you have the menopause onset that day occurs before the age of 40. And if you are 40 but less than 45, that's called early. And you can imagine a scenario, unless it's a situation, for example, that a person goes into menopause related to surgery or chemotherapy. You can imagine a situation where a person shows up and they're 38 and they're saying, I think I'm in menopause. And that's probably going to end up with um, not necessarily being the case that they will be diagnosed at that point in time with that, because it would be much younger than a physician would be expecting it to happen. And so it runs the gamut. But for, the average person, a really intense time of symptoms is 4 to 5 years, but like I said, up to 14 maybe. And then the types of symptoms that you have during the perimenopause stage you can also still continue to have them in postmenopause, but there are symptoms that you're more likely to experience leading up to menopause, and then different symptoms that are more common after that date.
Yeah, so I'm 53. I'll be 54 in September. I'm still in denial that I'm in my 50s. Is that okay? Like,
Yes, as particularly since if you told me you were 35, I would absolutely believe you without thinking about it twice. Literally.
You're too nice. You're too nice. Thank you. But yeah, like I'm, and that's a whole nother thing we could talk about at some point in time, but there are these milestone decade that come along, and I still haven't embraced being in my 50s, but I'm starting to embrace some of those things that 50 affords you, where you're not always worried about certain things anymore, things you say or things you do. And that's a whole nother topic of conversation. So there are some good things to this time in life, of course, but having to.
And I think that's a good point to raise, because it all ties into the mindset that is often the case in this country around the menopause journey. Because I feel like we are in a country that is very much focused on being forever young, no matter what it takes. And it does not recognize or minimizes the positives of getting older. In other countries and other societies, that isn't the case. And people may actually have neutral feelings about it, or even positive feelings. And their stature may actually increase in society as they get older, as they go through this life transition. And so I think it is really important and beneficial both to a person's mind and spirit, and therefore physically, to think about the mindset that they have at this time of life, and to not internalize the societal messaging that gets pummeled to people in this country, that menopause is linked to old age, and therefore you are a dried up prune and you really have nothing more to offer, and it's time for you to go out to pasture and not take up space.
Yeah.
Particularly, there are other people who look at it quite differently. And to your point, in terms of, there are people who do look at it positively. They are thrilled not to have a period anymore. They are thrilled not to have to worry about getting pregnant. And I want to make the point that after menopause has actually happened, because there are people during that perimenopause stage that are thinking they can't get pregnant. And that's when you have that surprise, like the mother of my college roommate did, when she got pregnant during that time. There are people by that time, they have gotten to the point, not everyone, but a lot of people have gotten to the point where they're pretty clear about who they are, what they're willing to put up with, the people they want to be around, the things that they won't do. To your point, caring less and less and less about what people think and the judgments that people make, and beginning to step into the power that they have always had, and feeling the freedom, as more years go by, to begin to focus more on themselves after having spent years and years and years and years focusing on other people, as is so often the case,
Yeah.
and really putting themselves on the back burner.
Yeah, that's a topic that I love talking about also. And so yes, there are advantages to our wisdom and the grit that I think we've all acquired at this point in time. And no, you're right. It's not appreciated. Again, ageism is another topic of conversation that I love talking about too. And what do we do about it? I don't have the answers, but it's definitely an issue that is being recognized more and more these days. But to your point about not have to worry about being pregnant after any point in time, I've never had children, so that is what it is, and I'm single. I hear out on the streets, if you're single and you're of menopausal age, for guys to know that you're not a baby maker anymore, there's something about like, they like that. Apparently that's an advantage with some men.
But I think that is also kind of what this brings up for some people, particularly so let's say people who are going through this kind of at a late 40s into middle 50s. There, for many people, can be grief that occurs. So there's grief about, they may not want to have a baby at that point in time, but not wanting to have a baby and knowing that even if you did, you couldn't have a baby is a very different thing.
Yeah.
And so there's grief around that. There is grief around who you might have been in the past physically, because of a lot of changes that can happen to your body. I think that it is the same type of grief that people can experience, for example, when they retire and they've been on that schedule. And now for some people, it's great. It's like freedom. I'm so glad this day has come. For other people, it's kind of, it's a feeling of loss. So I don't want to minimize that. And you can imagine for people who actually have the onset of menopause in their 30s or even younger, that's a whole other conversation about what that would be like, and the options that have now been taken off the table at a time when that shouldn't be occurring.
Yeah. And I think too, when we do talk about menopause, those symptoms are the things that are, kind of first and foremost, that's what you associate with menopause. But what you're saying about what's happening more psychologically, that it really is a different chapter, a new chapter of however you want to look at it from a positive standpoint, a renewal of what's the next chapter. But for many women who maybe didn't get their chance to be a mom in the traditional sense, it really is a loss, because I think a lot of us like to think about those plans that we had and the dreams and whatever, and to stop and think, well, that's not going to happen. As you said, there is a grief to that. It's a loss.
Well, and I think during this time of transition, for many people, it's happening at a time when there's a lot of other changes in their lives. So they may have children who are off to college. So a lot of people have a feeling of loss because the kids have kind of moved on and life is going to be different, but they still are going to be, forever their babies. They're still going to be worrying about that.
Yep.
And then you have parents who are getting older who may have more needs, and you're kind of in the middle. And then it's also a time where for some women, that's when their career can be starting to take off. And even though if that's a really positive thing for them, moving up in the world can be very, very stressful, even when it's a positive. And
Yeah.
it just can be for a lot of people a time where you've got menopause journey happening, but also a time when all these other things are going on. And it's a lot and it can be overwhelming.
It's and I want to talk more about, of course, the symptoms we know, and some of those lesser known symptoms, et cetera. I want to get to that. But since you've worked so much in employee health on that side of healthcare, how do employers look at the menopausal phase, and what's lacking from an employer standpoint when it comes to women in menopause?
And I am really glad that you asked that question, because I would say for most companies globally, actually, some countries do way better than we do, like the UK. But for most companies, it is the case that people are not even thinking about the existence of this life transition. And so there isn't support programming around it, which I literally, my brain kind of explodes with that, because it just kind of reflects a thought process that there's a lot of support around the reproductive years with regard to maternity and
Yep.
issues with infertility. But once you're kind of past that time, and I think all of that is definitely needed and continues to be definitely needed when you start looking at how the US ranks with regard to maternal and infant mortality, particularly, for example, if you're a Black woman. So definitely not to take away from that, but it's then afterwards you kind of fall into invisibility from the reality that life goes on and there's another transition that happens, and that is just as important, and in some ways more important in terms of what the rest of your life is going to look like. And I have said, several times, to me, it's the equivalent of you take your child to the pediatrician, and when the child turns 13, they say, good luck between now and 18, and then you can go to an adult, a physician who's focused on adults. And that in between period is you're just like out there on your own, which would be crazy. And to me, it's equally crazy that that's how it gets manifest for most employers right now when it comes to knowledge, awareness, benefits, etc. I mean, I think it's, it's very, very, very slowly changing, but I still find it curious, I'll put it that way. And certainly unfortunate, because and I would actually say most of the challenges that women can experience related to this normal life stage are challenges that can be overcome. And there's a lot of unnecessary suffering when there are solutions to address the issues. But people are not aware. And, both on the part of the employer and both on the part of women. And there's just no reason to suffer in silence. And there's just no reason to have to suffer and face many of the challenges that people do when there are answers out there.
Yeah. So, and in my past life, I was working for health systems in a sales and marketing capacity, and then I moved on to moderating market research, which is what I'm doing now for healthcare and pharma companies. But back in the day, I sold occupational health services for hospital systems, and employers were offering things like smoking cessation classes and weight management, and we were doing health screenings and health risk assessments and things like that. And maybe there was a little bit of focus on women's health and all of that. And then things like maternity leave expanded. And then now we've got paternity leave for, the partner's dads, however you want to term that. And there just is nothing after that. And even from a coverage standpoint, from an insurance perspective, which again, you have so much experience in that too, all the things that have been covered, whether it be birth control and, don't get me started on that little blue pill and coverage for that, that's okay. But trying to get coverage for, and I want to talk more about hormone replacement therapy in more depth as well, because I think there's a lot of questions out there about, well, what's the synthetic stuff versus the bioidenticals and what's safe and what is it? There's so much around that now too. But sometimes it's very hard to get HRT covered. I can even say for myself at time a few years ago when I was recommended to get the patch, which is a combination of estrogen and progesterone patches, a combination patch. With insurance, they wanted $500 a month. That's insane. And then when I decided I wanted to try it again, I had to be, we could call it maybe somewhat inconvenienced by having to wear an estrogen patch twice a week, change it twice a week, and then be on progesterone every day, but it was an oral prescription, so having to juggle two prescriptions and whatnot, and it was cheaper than a patch, but this is what workarounds that the doctors had to use to get what I needed prescribed. What are your
Well,
thoughts on insurance angle of all of this?
So I think from my perspective, and this applies really to employees of either sex or gender identity, that once you reach a certain age, to me, certainly not 100% of the time, but a lot of the time, it goes from a more personalized view to you become diabetes, you become heart disease, you become your condition, and it becomes much more of a homogeneous scenario with not complete invisibility because of the conditions for which the programming is required, but it's just different. It's kind of you shift at a certain age to a thought process and approaches in some cases that are very different than in your earlier years. And like I said, I think that applies not just to women. And I think in terms of some of what may become the issue with regard to coverage is just a reflection of people not really being aware or really knowing much at all about the menopause journey and not recognizing that even if your sole goal is bottom line cost savings, that the hormonal changes that take place during the journey increase the risk for a lot of chronic conditions like heart disease, like stroke, like hypertension, high cholesterol, metabolic syndrome, weight gain, anxiety, depressive symptoms, etc., that they may have programs for, and are aware of. But my feeling is if no one in the picture and the programming is thinking about the possibility that the menopause journey and the hormonal changes may be contributory, then employers are not really optimizing the care management programs they have in place. And it may be that the person who has depressive symptoms who gets started on an antidepressant that ends up not being all that effective really needs to have hormone therapy because it's all tied to the hormonal changes. And an antidepressant is not going to change that. Or maybe they need both.
Right.
So I think it's a lack of knowledge and understanding of everything that happens during the journey. And it's also the case that for people who may have had well-controlled chronic conditions, then they begin to notice that it's harder to keep things under control, even though what they may have been doing in the past hasn't really changed because of that hormonal component that is now contributing to the picture.
Uh-huh. Right. So when we talk about symptoms of menopause and again, some of the very well-known symptoms of hot flashes and night sweats and the weight gain, and then we end up having these body image issues and the brain fog and the emotional roller coasters. I had an aunt when I was a little girl. There was my grandmother's. I lived with my grandmother during the week, because my mom worked, and one of my grandmother's sisters who lived close by would walk over and come to my grandma's house, and I'd come home from school, and I was always happy to see Auntie Celia hanging out with us. And there were times where she would just look at me and start bawling. She would just start crying. And I think probably at that point she was maybe in her 50s. So this would have been in the, maybe, oh God, this was probably like early 80s, I think I would say. But she was probably somewhere in her 50s, but nobody talked about menopause back then. We don't even know if my grandmother had a menopausal journey because she never complained about anything. I don't
Right.
know. But now when I go back and think about that, because there's times that like anything could trigger me and I'm just a puddle. I'm just weeping for some reason. And it wasn't even from like a Hallmark movie or what's the animal ASPCA commercial with the animals. Just
Right.
for no reason. So all these emotional things are happening too. So those are maybe the more well-known symptoms, but you sent over a list of some things that we don't think about. And it's incredible that these things could be a result of menopause. And you've got here body odor, change in body odor, cold flashes, muscle and joint aches and pains, which I've experienced that, hearing loss. So I've had some issues with tinnitus or tinnitus, however you want to pronounce it, ringing in my ear. That could be associated with menopause too. Dry eye, I've had that. Migraines, oral issues, dry mouth, burning tongue, metallic palpitations, gas and bloating, shortness of breath, leg pain, restless leg, pins and needle feelings, UTIs, urinary leaks and urgency. And so, that's all of those symptoms. Now, if we had to go through the list and put them in categories from a physician specialist perspective, now we're saying, okay, this is urology and this is ENT and this is neuro and this is this. And so now we're in a position. I've experienced this myself. Okay, well, like, why do I feel these aches and pains in my joints and my muscles? Oh, got to go to the rheumatologist and figure out what's going on. And then to come find out that a SED rate or an ANA, which is for inflammation, is fine. Everything's fine. There's nothing wrong with you. So if we go back to the premise of the podcast, being desperate for a diagnosis and you're experiencing all these things, and doctors can't find anything wrong with you, at what point does it make sense for the woman as a patient or the physician to say this could be menopause? Because like you said, a lot of women can be taken down the path of needing an anti-anxiety prescription and it's not helping because, or antidepressant for depression, but it's not helping because that's not her issue. So at what point is menopause the aha, this could be what it is? And then what does a woman do? And, what are some of the solutions?
So I would liken menopause to COVID from the perspective that just as COVID can impact any part of the body, including the brain,
Hmm.
when you have a hormonal change, or if you have a condition where hormonally something is dominant or very, very deficient, or a hormonal change that's related to an autoimmune condition, then, given the number of receptors that we have everywhere in our body related to one hormone type or another, then you can pretty much see the whole array of symptoms. And I'm certainly not saying that every woman who's at a typical age that that's what the reason is. It could be, well, that if you have palpitations, it really is an issue with your heart as opposed to falling estrogen levels. But I think it's one of those situations where women need to be educated and empowered and aware enough to bring it up that this might be a possibility and really press if the first response is to blow them off.
Yeah.
Because I think, to your point, that it's often the case that women experience medical gaslighting and they're told you're perfectly fine, it's just stress,
Mhm.
which happens with other scenarios as well. But you can see how you can end up in a swirl for a very long time, going from pillar to post, going down different pathways and not getting answers, which then just over time becomes more and more and more discouraging. Women may begin to doubt themselves. And the more that people aren't finding things, the more likely it is that, when you go to that next clinician, they are going to be thinking that it's on you. Um, so I think that it's something that people need to be aware of what the impacts can be. And if their physicians are not thinking about it, and a lot of the time it's going to be the case that they are not, that they need to bring it up themselves. And I think that's absolutely the case where it's a situation where you're 38, you haven't had the surgery, you haven't had the chemotherapy, but you're having symptoms that are very typical of what people would think of as menopausal symptoms, um, to bring that up. And although, this brings up another point, in general, lab testing for menopause is not recommended for the general population
Right.
because, particularly during perimenopause, your hormonal levels are bouncing all over the place. So one day you could take the test totally normal, the next day totally abnormal. And so when you're looking at large numbers of people, the recommendation is not to, test every woman on some frequency. But I think it definitely makes sense in a situation where you're having the symptoms and no one believes you because you've hit menopause, so that is going to show up in a lab test.
Uh-huh.
Or you are having symptoms, and perhaps if you do get a lab test, it will be on a day when it's abnormal. And so people will be at least willing to entertain the possibility that that could be. But I think it's one of these scenarios. And, I've done 2 rounds of markets research many years apart. And it is frequently the case that women feel like this whole thing became from out of left field and they were completely unprepared and no one gave them a heads up. And that people aren't necessarily going to bring it up during a visit with their clinician, or that if they do bring it up, then the response may be, gaslighting, or the response may be to just write a script. And just given all the impacts and all the different changes that are taking place, both in terms of physically, emotionally, mentally, it's really important to have an opportunity to have those ongoing conversations about the whole process. Because just like in my mind, there are very few things where there's just one thing, you take a pill and that's the end of it. Infections, you take antibiotics, okay, one and done. But for so many other things, yes, there may be a pill for it, but that still may leave other things where there are other contributory factors that need to be discussed to bring a person to a point of optimal health and well-being that may require more than a pill. It may be lifestyle changes, it may be non-hormonal options, etc. But it definitely warrants a real conversation and conversations over time.
I love some of the statistics that you had sent over to me. I'm going to go through a few of them here from a perspective of some data from the UK. You said here that 44% of women experienced a 1-year delay in the diagnosis of menopause. And then the rest of these are US sources. 40% of women delay seeking treatment for 6 months or more. 25% of women were never told they were in perimenopause. 33% of women with a delayed diagnosis of 3 years or more, and 18% of women with 6 visits had 6 visits before receiving appropriate treatment. Talk about the revolving door of healthcare. And I think too, and I'm speaking from my perspective and experience also, and some of my friends who have gone through it and are even more seasoned, wise women who have gone through this entire phase, that it's so frustrating because even something like fatigue, oh my gosh, when you look at as physicians refer to the differential list, all the possibilities that it could be, fatigue can fall under so many things. So
Exactly.
like I said, even for myself, I many times have gone to a variety of physicians saying, I'm so tired. I don't understand. And I've been through my PCP, my gynae, a rheumatologist, an endocrinologist, an integrative medicine physician, internal medicine physician focusing on integrative, and going through all boatload of labs. And maybe there was I was low on a vitamin here or there, but even those things, we don't know if we're low on a vitamin. And I know that trying to get tested for hormonal purposes is rough too. And I don't know if all women really understand why a lot of physicians, be it OBGYNs, et cetera, don't always test, because many times I've said, well, you're going to check my levels. And a lot of physicians have said, estrogen, progesterone, testosterone, all of those hormones, reproductive kinds of hormones. And they've said, well, I could, but like you said, on any given day, they can be up or down, and they will prescribe HRT based off of symptoms. And so that's a little frustrating for me, because I'm looking for what's my numbers? What's the proof? But so many physicians do prescribe hormone replacement therapy just based on symptoms. What do you find that's common?
So, I think it is complicated, and you can imagine that if you are going to a physician and you have an array of symptoms, and given the fact that when you look at surveys, 69% of OBGYN residencies don't have a designated menopause curriculum. So if you are a GYN who is focused on women's health by definition, and you are not getting sufficient training, then it's unlikely if you're going to be getting it if you're a family practitioner or a GP or an internist. So a person comes to you with a collection of symptoms is definitely not going to be top of mind. And I think that it's also important to recognize that people should not just automatically assume that everything is related to the hormonal transition and put it off to that, and therefore don't even seek care when it really could be something else that's going on. So the fatigue, yes, that could be related to your not getting enough sleep because of the night sweats and the muscle aches, and um then you're fatigued and you attribute it to that. But it's also the case that around this, the kind of the more typical ages, that the likelihood of someone having a thyroid condition is higher as well. So I want to be really, really clear that it's kind of two sides of the coin.
Yeah.
That there are lots of symptoms that could be related to the hormonal transition. And that is why people absolutely need to think of that, to your point, in the differential diagnosis. And it shouldn't be like the very last thing on the list. By the same token, because you don't want to have like the reverse happening where people get themselves in real trouble with a completely different problem and they have put it off and then they're kind of sucking it up because of the taboo, because of the stigma, because they don't know what their options are, because when they want to talk about it, no one is willing to even talk about it and answer their questions. So, like I said, I think for every person, their health journey is unique. And during this life transition, it is unique to each person. And so I think, like in anything else in healthcare, you have to look at the person in front of you, really listen to what they're telling you, and think of all the possibilities. And yes, in the majority of cases, it's going to be XYZ, but you have to take all those data points into account and think about what else might it be. And if the patient is telling you they think that it's, ABC, to not dismiss it and pursue it. When I was taking care of patients, which really, really love doing, definitely still miss it. I learned very early on that if you really listen, zip it and listen, that a high percentage of the time, the patient will tell you what it is that they've got. They don't know what the diagnosis is. They aren't using the medical lingo, but they will tell you enough for you to then put the puzzle pieces together. And I would say a high percentage of the time when a person comes in and they say, I think it's this. Now, granted, you have to take into account what people are reading on social media, et cetera, et cetera, et cetera. But a high percentage of the time, I think still that when people have a gut feeling that it might be something, I think that you don't just kind of dismiss that and tell them, no, it's not that. So, I think the key in these situations is really to look at each person as a person and not be dismissive, just in general and taking care of patients. And I think that will lead you to a better place in terms of delivering better care, more compassionate care, getting to an answer and getting to whatever it is that's needed to address the issue.
And I'm sure that there's plenty of physicians who maybe don't have the education or the tools to offer a patient who's exhibiting these symptoms that could actually be related to menopause, and they're just telling you, just live with it, go walk, get some fresh air, meditate, whatever. Or like with the weight gain, there seems to be, and I'm seeing this a lot I must be looking at a lot of menopause information lately, because all the reels that are popping up for me and ads are all about menopause programs and menopause coaching. And we're going to talk about yours with all of the tools that you're offering, which is an incredible depth and breadth of tools for menopause support. But it's so easy for a physician to say, well, you know, eat less, to work out more. And that's so easy for a physician or really anybody to say, but it seems like, metabolism is different, muscle mass is different. What worked before, as far as like, I hear a lot about, well, cardio might have worked for you before, but now cardio is maybe overstressing your body, causing more cortisol, inflammation, etc., in your body. And really, strength training is better, and you should eat more protein. And so there's just so much information out there. And or why are we hungry? Like, I'm hungry all the time. Like, I'm thinking right now, what am I going to eat when we're done? Yeah. So like, that's what's going through my head, aside from this amazing conversation that we're having. But like, a couple times it pops into my head just now. What am I going to eat when we're done? So how does a woman sift through all of that? And I am still interested, though, on your take on the difference between synthetic and bioidentical hormone replacement. But aside from that, like, how does a woman, like, just, if she's kind of on her own, how does she sift through all of those things?
Well, I think that one of the things is becoming educated herself. I have said for a very, very, very long time that my hope for patients in general is that they would step into the power that they have and be like what you frequently see in parents of a sick child with cancer or some rare condition, right? They are intimidated, they are petrified, and they don't necessarily understand all the medical lingo that is coming at them. But they recognize they've got to understand what's going on. They've got to know what the options are. They cannot be blown off because it's their child's life at stake. And so they do educate themselves. Sometimes, you see the movies where the patient becomes the expert even more than the expert, because the patient has spent all of their time looking at every study globally, which the expert may not have had time to do. And so while people in those situations frequently take on that behavior when it comes to themselves, they just often do not. So I think that is a lot of it. You have to be active and take some control when it comes to your health and well-being. This is not passive. No one is going to ever be in your body. No one's ever going to be in your mind. They're never going to really know what it's like to be in your skin. And you are, in a way, the CEO of what's going on. Now, the CEO does not run a company all by themselves. They have people who know things that they don't. And a good one knows what they don't know. So then you do seek help, but you can't just be a passive participant. And if something doesn't make sense, you don't understand it, then you've got to say, I don't understand that. That doesn't make sense. Can you explain it? It's not hanging together for me. Or I hear what you're saying. I'm sure it may work, but in my particular situation, because of these three factors, that's just not realistic in terms of what I'm able to do. So what are my other options? Or what are my other options? Is it only hormone therapy that's going to help me? Or if I'm petrified, even though it may not be justified, then help me get to that point. But in the meantime, tell me some other things that I actually can be doing. So I think that's really very important. The whole self-advocacy component, the education component, and looking at things in a different way. I totally get it where you didn't go through medical school, and people often use big words, and you're in pain or you're frightened, and half the stuff they're telling you isn't coming through. But at the end of the day, if you leave and you really didn't walk away with like, what is going on? What might be going on? What are my options? Then you just can't leave until you are at a point where you feel like you understand sufficiently what your options are, what things could be done, and what you are realistically able to do, whether it's life circumstances, whether it is your job schedule, whether it is what your budget is. But you've got to keep going back and saying, no, you've got to get me to the point where I know what's going on, because I can't even do what it is you want me to do if I don't understand it and if I don't understand why I should be doing it. So I think that that's very, very, very important, and not just for this life transition, but when you are navigating healthcare, period, and it's not a minor point, it's one thing if you get something off of Amazon and that doesn't work. Here we're talking about your life. And do you end up with a delayed diagnosis and now you're in a life-threatening situation? Or do you accept being blown off? Or do you yourself start to question what's going on and then not seeking help? So that's kind of my take on it.
And so many physicians are very put off by patients coming in with loads of paper from Dr. Google, as we say. I don't know, physicians, they kind of are on their own track, and they only have so much time also, as we know, in an exam room. So,
well, and I think that part of it, and for me, when I was taking care of patients, I had a different take. And I think that some of the ways that I was as a physician, that's just kind of who I am as a person. And so when people came in, like you said, with reams of information, and they would say, well, what do you think? It's like, I have no idea what I think, because now I need to take what you brought me and go through it and then get back to you. And you've got to have the confidence in yourself to be able to say that, and also not feel like you have to know everything, because that's a complete and total possibility. And I think that it's also the case, and this is one of those situations, and this is all the forces that come to bear for every person and every part of the healthcare system that are negative things, but realities, until we all collectively say, nope, we aren't going to do it. So when you go to the physician, you may feel like, I should be able to go on and on and on and on and on and on and on. Well, unfortunately, that's just not going to happen unless you are, paying top dollar, and their model is for that. So you've got to get yourself organized before you go in. I know it's extra work that you feel you shouldn't have to do, and in an ideal world you wouldn't, but we certainly don't live in an ideal world right now. So you need to have yourself organized. You need to know, like, what are your top priorities? What are your top questions? What are the 3 points that you've taken off of Dr. Google that are concerning you to ask the question? Because then it makes it much easier for the physician to support you in the way that's going to be the most efficient, the most effective, the most satisfying, and feel the most responsive to you. I mean, it's just a responsibility that people have to take, because once again, at the end of the day, the parent may care more about the health and well-being of their child, particularly if the child is 2 and they don't even have any clue what's going on. They just don't feel good. But as an adult, on average, for most people, no one is going to care more about your health and well-being than you are. And therefore, you've got to take some responsibility. Yes, they're going to be family members. They're going to be partners. They're going to be people who need extra help because they are very depressed and they can't even see any point in getting out of bed, much less thinking about their health and well-being. So everybody needs help lots of the time throughout life, but you can't just be totally passive and not take the bull by the horns and engage. And so I always viewed people who came in those scenarios as, I'm really, really thrilled that the person is engaged, right? They have taken time and they have searched. And so they are trying to figure it out and they understand that they need help. And they're actually saying to me, well, what do you think about this? As opposed to just assuming that what TikTok is telling them is what's going on. So that's kind of how I look at it. But I mean, you have to have your act together when you go in. Am I saying that's it's time consuming, it's tedious, but it's the reality. And so I think until, like I said, as a collective, all the parties within healthcare look at what's going on in a very different way and wield their power to make it be different. In the meantime, it's going to be extra work for everybody, and it's going to be burnout, and it's going to be inefficient, et cetera, et cetera, et cetera, unfortunately.
Speaking of TikToks and the reels, which is where we're getting so much of our education. I learned it on, Instagram or TikTok, whatever it is. But there is a lot, I've noticed that there are a lot of reels with, I'll just say, people who are promoting HRT and have like their own, I don't know, access somehow to HRT prescriptions. And, you don't really know who these people are, but I feel like women are interested in something that's going to quell their system or their symptoms. So, again, lots of kind of controversy and curiosity around synthetic versus bioidentical HRT. Can you help kind of parse that out and clarify the differences?
So I would say that the biggest issue when it comes to the various types of hormone therapy comes to the scenarios where something is compounded. And the reason for that is
So compounded meaning what?
Compounded that you go to the pharmacy and they create something that is, this percentage estrogen, that percentage progesterone, a little pinch of this, a little pinch of that.
Okay.
And I think that, first of all, there are very few compounding pharmacies. There are even fewer compounding pharmacies with the rigor and the knowledge base and the quality controls. And therefore, when you go the compounded route, and I'm not saying it's 100% no-go, but when you go the compounded route, you have no idea at the end of the day what it is you have actually gotten. And that's the problem. The FDA approved whether, they are bioidentical, or the synthetic, their quality controls in place. And you should be able to, I will say that, it's not 100% by any means, but you should be able to trust that what it is that you're getting is actually what it is that you're supposed to be getting, that's not contaminated, that's in the dosage that you're being told that you need. And it's also the case that I think many people may not recognize that there are many different formulations of hormone therapy. So it's not just pills. And to your point, there are patches as an example. And it may be that if your main symptoms are the urinary tract symptoms, the pain with sex symptoms, you may not need to take a pill or, systemic therapy, which means, is going through your entire body. You may only need to have a cream. So I think it's important to realize there are lots and lots and lots of options and permutations and forms of delivery of the medication. And there are going to be a few people where the compounded will make sense. And the hope is that they go to a compounding pharmacy where they take their work seriously, they know what they're doing, and when they give you what they give you, it actually is what they are saying and it's not contaminated. So to me, that's really, one of the messages around hormone therapy that I think people should get. I would also like to point out that there was a time in this country where women of a certain age, when they reached a certain point, everybody was on hormone therapy. And, unfortunately, a study came out that was misinterpreted, widely communicated in its misinterpretation by the media. And then we went from one extreme to the other, where now nobody on hormone therapy. And now we are beginning to come back to the middle and look to see, what are the benefits in terms of symptoms today, in terms of risk reduction for the future, and what are the risks in an individual situation, and is the risk the same if you're taking a pill or if you can get by with a cream. And so
a cream that would be topical or
correct,
vaginal,
where it's not getting into your bloodstream.
Okay.
Right. So there are people who have been told because of their past medical history, they can't have hormone therapy at all. But when the studies have been
breast cancer or
correct,
breast cancer in the family.
So, but the studies that have been done to date, and let's face it, there have been times where a study today, 15 years later, has been shown to be incorrect. So you can only make your best decision based on the best information at the time. Mm-hmm. And so there are people who actually could use a cream for certain of their symptoms, and the risk of having a problem is pretty low. So I think that hormone therapy is a great thing for a lot of women. There are going to be some people who cannot take it. There are going to be some people who don't want to take it. There are going to be people who want to try something else first. There's some people who are going to want a combination, and a lot of people are going to want a combination because just like most things, it's not a panacea for every single symptom that you might have. It will help with a lot of things, but there are other things that it's not going to help with. And there are other options out there. There are non-hormonal medications, for example, for the hot sweats. A lot of when it comes to weight gain, hormone therapy may not help you with that. When you look at the studies, and I still find it very hard to believe, the average amount of weight gain that the studies show a woman gains during that time is way lower than anybody I know. I think it's awesome.
Yeah,
I think it's awesome.
Oh, sorry. I follow some of those, menopause related Facebook pages too, and some of these women are just they'll say, I gained 20 pounds in a year,
right?
Whatever. Certainly, I don't know what they're eating or whatnot, but just for myself, I've said I can eat crap and not work out, or I can eat really well and work out like an animal at the gym several times a week, and my weight still stays the same. And then I think about what I used to weigh 15 pounds less not that long ago. And I just think, well, what the heck happened? So.
Well, and I think that some of it is related to the hormonal transition because the studies do show, a certain amount of average weight that women gain related to the hormonal changes. But people also need to recognize that they start losing a lot of things at a much younger age than they know. So you start losing muscle mass when you're 30. You start losing your degree of balance when you're 30. So these things are kind of simmering in the background in ways that you don't really notice, but it eventually over time accumulates and catches up to you. So that's why I believe that this is a perfect time, if you have not been taking care of yourself, to start to take care of yourself, because number one, it may help in terms of your symptoms right now, but in terms of your risk for chronic conditions and management of chronic conditions, there's a huge payoff. I think it's also important to recognize that this is can be a very, very stressful time related to the symptoms, related to other things going on in a person's life. And so people have sky high cortisol, which is the stress hormone. And then you have an imbalance of the hormones that, control your feeling of fullness and how soon that happens, and control your appetite. So there are a lot of different things that can be going on at the same time that then contribute to an overall degree of weight gain that certainly makes nobody happy. And if it, becomes excessive, then really becomes a threat. It's not an aesthetic thing according to some people's beauty standards, but it really is a threat to health and well-being. So I think the things that contribute to longevity, the things that contribute to overall health and well-being, healthy eating, moving on a regular basis, and in terms of physical activity, not just cardio. You have to do balance. You have to do strength training. You have to do flexibility. And you should be doing that all along the way from the very, very beginning. But if you haven't been doing it, focusing on getting enough sleep. So I know it can be really hard and sometimes it's impossible. And in some situations, you aren't going to get more than five hours a day. That's your life. But try your best to prioritize that. So if there are some things that you cannot do, or some things that you can do less frequently, or some things that you can just kind of let go for a while, getting that sleep is key. You have the issue with not getting enough sleep. You have that hormonal imbalance when it comes to the hormones that control your feeling of fullness, your food cravings, your appetite. You've got the issue with not getting enough sleep, not having, then being fatigued. You're fatigued and now you're irritated. Not getting enough sleep, increased risk of dementia. You aren't getting enough sleep, you aren't paying attention, you don't realize you have sleep apnea. So now we've got increased risk of heart disease, you've got increased risk of dementia. And then really making sure that you are focused on your stress level. And if you don't have any coping techniques, starting to figure out, first of all, giving yourself the time, even if it's start off with like 5 minutes of, I am going to take some deep breaths, and whatever else is going on, I'm going to give myself at least 5 minutes to take some deep breaths and not worry. And then just gradually build that up. And there are lots and lots and lots of options of things that you can do and experiment with to see if it's going to work for you. Is it going to be meditation? Is it going to be yoga? Is it going to be physical activity for you? Is it going to be alone time? And then the importance of having that human connection, because we know the impact of people feeling isolated and feeling lonely, and the devastating impact that people can have on their health. And so to me, this is like the perfect opportunity that if you haven't been doing it, get on board the train. And, your symptoms today and your future you will be really, really glad you did. And once you start even doing, I find that it's, often the case, pick one thing. You can't do everything at once. So if you start eating better, then you start feeling better, then you're more likely to engage in physical activity and be and socialize. Or if you are physically active, then you're less stressed, then you feel motivated. You've gone through, done all that physical activity, you aren't going to go then stuff your face with a big hunk of cake. You're less likely to do it every single day.
Chips and guacamole right here. That's where it's at for me. But Dr. Edwards, you, with all this expertise and the complexity of menopause, you have put so much passion and heart and soul into your program, Positive Health. So yes, everyone, positive, like menopause, Positive Health. Tell us about your program, what's available, how to access it. This is very, very exciting. This hub for all things menopause. It's so cool. The website, everybody, is so easy to navigate, and just it's fantastic. So Dr. Edwards, tell us about it.
Oh, thank you for that. Yes, I've been thinking about this for a very, very long time, and some things came together. Kind of moving through some of the changes in healthcare that happened as a result of the pandemic that led me to believe that there was an opportunity for me to contribute something that I think could help people going through the menopause journey from a lot of different angles. And so right now we have a pilot program going on right now that people are free to join. And the idea is that this is going to be holistic and a place you can go and find a lot of education, care, support for the variety of symptoms you may be experiencing.
And holistic, Dr. Edwards, what does that mean for you and your program, holistic?
So holistic is, for example, we recognize that different people process information in different ways or have preferences. So when it comes to education, we provide education through text messages based on topics that people select that are important to them, so they don't have to go searching all over the place. We have webinars with fantastic speakers. We have a podcast series. We have a newsletter. Holistic means starting this month, we'll be able to provide access to menopause-trained clinicians to do an assessment as to whether or not hormone therapy is the best option for you in your unique situation. And if it's not an option, what are some of your other options? You have access to a peer-reviewed, clinically validated diet assessment that will take information about how you're eating now, what your goals are, and what changes you are willing to make to how you eat to achieve your goals. And then you get a score that you can track over time to see how you're doing. The assessment is focused on food quality and nutrient deficiency. So it's not a weight loss program per se, but the idea is if you focus on those things, then things like weight loss and management of chronic conditions and risk reduction will take care of themselves in a healthy way that is sustainable. And you'll get recommendations about dietary patterns that fit with what you're trying to accomplish, as well as access to recipes. You will have access to physical therapist-led videos for the aches and pains of muscles and joints that many women experience, as well as pelvic floor issues like the urinary leaks when you cough or laugh. And for the first 100 people who enroll in that particular program, you will get 2 free consultations with a physical therapist. You have access to all the content that's on the website. You have access to digital cognitive behavioral therapy to help address stress, anxiety, depressive symptoms. If you decide that you want or need to order at-home lab testing, we have that available at a discount. And for me, what I'm trying to do is put together kind of all the different pieces and parts to help address the many, many symptoms that women can experience while they are on the journey, and have one place that they can go, as opposed to having to do the searching, do the curating, and having 12 apps on their phone. So that's really the goal. And we also have a new feature that we recently started in terms of a menopause community, for people to have a safe place to hang out and be themselves and talk about what they are going through and get some tips, etc.
And do you have an app, Dr. Edwards?
We currently don't have an app per se. You would get a link that that would go on your phone, and that would be your access. So,
Okay.
it's available on mobile, desktop, etc., but not an app per se
Yeah.
right now.
Yeah. Well, I can't get over all of the information and services that you are making available through your website. And I think it just goes to show how complex menopause really is, because as you said, at some point in life, now we're diabetes, now we're potential heart disease, we're all these things. And underlying, if we are in a position where we're contending with all of those different conditions, and then this underlying thing of menopause is happening, but being put on the back burner in so many ways, and maybe isn't the first thing on the radar, so much is just falling off from our knowledge base, and then it's hard to figure out, well, how do I learn about all of these things, and where do I go? And yeah, you do searches on menopause, and oh my gosh, there's just so much to sift through. So I love that this is I'll just use a cliche, one-stop shop for all things menopause, and not just to read, but to interact and learn. And if a physician is a little averse to doing any kind of blood work or blood testing, lab work, it's available through your site. So that's amazing that you've done all of this, and so much passion and time put behind it.
Well, and the other thing that I wanted to point out, that it's very important to us that this be seen as an experience and services that are truly meant for everyone, because women for far too long have been viewed as nothing but a shorter version of a man, and we aren't. Research, dollars, funding for programs around women's health, woefully inadequate, and literally, if you are a man with programming for a woman's health situation, you're more likely to get funding. Still, women are still not included in clinical trials the way that they should be. And then when you start looking at women of color, when you start looking at members of the LGBTQIA plus community, it just gets orders of magnitude worse. So, each journey is unique. There are differences that are seen when you look at women of color versus white women on average. It's not going to be 100% aboard, across the board. And it's not so much about genetic differences, because we're all, when you get down to that level, 99% the same. But the impact that the experiences that you've had during the course of your life, the access you have had or not had to resources, the culture in which you have been raised, etc., all can have a huge impact. And then in terms of, for example, the LGBTQIA plus community having even more problems finding and having access to clinicians with the requisite training, expertise, and really welcoming approach, having access. And then just in general for women, given, what we've talked about in terms of the training that people have, it's important and fantastic. There are clearly OBGYNs who, despite not getting what they needed when they were in medical school and residency, recognize, yes, I am in it for the for the life scan, or have a particular interest. and they've done the extra training, the extra reading, et cetera. But there are a lot of people who have not. And so it may be that you're then going to have to look for someone who does have that additional training. So, the bottom line is that this is someplace that everyone who comes to it should feel seen and heard and welcomed, and that we're trying our best to provide the support here, resources, education that will put them in the best position to take control of their health and well-being and do what is going to the best fit, the best treatment, the best approach for them, taking into account the reality of what may or may not be possible in their particular situation.
And I'd like to point out to everyone that Dr. Edwards is pursuing this as an entrepreneur, female entrepreneur, which I 100% support, as I am one myself. And folks listening out there, hey, you've got access to venture capital and want to make an amazing investment here. As Dr. Edwards said, there's way less support for these types of initiatives from a venture capital standpoint, backing, funding, etc. Hey, somebody who wants to invest in this amazing venture, I totally encourage it. It's needed. We need it as women. We need more support like this, and it needs to be recognized. So, Colette, I know we've talked about female entrepreneurship and how hard it could be to get things moving along, and hopefully we can get a plug for you for some VC here.
Yeah, and I appreciate that. So, with regard to the pilot, as I said, it's open to everyone. It is free. The only things where there might be a cost would be if you decide to do the at-home lab testing. There would be a 25% discount. And then with regard to the menopause trained clinicians, you would also get a discount, but those things would be out of pocket. But otherwise, everything else that I spoke about is free. So come one, come all. And you can go to positivehealth.com, and that's PAUSITIVE health.com. If you put in the regular spelling of what people are going to think of as positive, you're not going to find it. So PAUSITIVE health.com. You'll be able to look at the website, and there will be a button there for where you can become a member and join the beta.
And what's the name of your podcast? Is that up and running?
Menopause the Positive Way.
Okay. Menopause the Positive Way. Menopause the Positive, PAU.
Exactly.
Okay. I know, because there's positive, happy positive, and then
Right.
times like animal related kinds of businesses is using pause, PAW.
Yeah, right, exactly.
So let's just be clear,
This is-
everyone. It's PAUSITIV. That's
E.
or VE. Yes.
Yeah.
That's fantastic. Well, Dr. Edwards, thank you so much for sharing all of this rich information on this stage of life, which we should all be looking at it as this amazing transition and season of opportunity, but doesn't always happen that way. And I like to look at the silver linings of these things. So hopefully all of you in this phase of life find some silver linings, but also find the support you need, whether it's through Dr. Edwards' program, Positive Health, or through your physicians, or just the camaraderie of good gal pals, etc. Make sure you do it. Don't stay in isolation in this point in time, because all these things that are happening to us, yes, can really make an impact on our psyches. I've been there myself, where I've just spent evenings on the couch because I didn't understand what was going on with me, and I was tired and all of this, and it took me to, kind of take control, and taking control makes you feel a lot better. Let me just tell you. So
Yes.
Take control, everyone.
And don't suffer in silence. There's no
Exactly.
reason to do that.
Absolutely. So whether it's menopause or anything else going on, physically, mentally, get it checked out, and any momentum is better than none. Make progress. So thank you, everyone. Thank you, Dr. Edwards.
Thank you so much for the opportunity. I really enjoyed the conversation.
Me too. Me too. And thank you for coming back to talk with me, and maybe you'll even come back again.
Absolutely.
Do some follow-up and talk more. But everyone, again, this is Laura Nozicka, host of the Desperate for a Diagnosis podcast. Stay well and keep pushing for answers.
Oh my goodness, that's a wrap on another compelling story. Thanks for listening to the Desperate for a Diagnosis podcast. If you would like more information about today's guests or to find out more about Laura, me, go to desperateforadiagnosis.com. If you enjoyed the show, please subscribe, rate, and review the podcast on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. You can also follow show updates and healthcare news on the podcast's Facebook page. If you would like to be a guest on the show, or if you have any questions, advice, or suggestions for our guests, please email me at lauramarie@desperateforadiagnosis.com.